currently the Parliamentary Secretary to the Minister of Health on the Conversation on Health. Welcome. Do you see this as a step in shaping or changing the relationship between government and citizens?
It's an interesting question because, of course, this began as an initiative to try to engage British Columbians in guiding an important piece of government policy. But I think you're quite right in that it has the potential to affect a positive change in a lot of other ways in which government interacts. This is an unprecedented process in terms of its size and scope. So perhaps this will teach us something about future engagement of the public.
So I'm here at the office of Adrian Dix, MLA for Vancouver Kingsway, and the current opposition critic for health. Welcome. The reason why I'm here today is I'd like your thoughts on what you think about the current government's initiative on the Conversation on Health.
Well, I don't think there's anything ever wrong with talking to people, engaging people about the healthcare system. It belongs to everybody. But there are some elements of this that I'm concerned about. One is that you have to tell the truth. And the government sent out a very expensive advertising campaign prior to starting this conversation that said that the healthcare system was unsustainable. Well, their own former Deputy Minister of Health, Dr. Penny Ballum, has said that's not true. The evidence says it's not true. And what we have is an effort to scare people, to suggest that we can't afford our current public health care system, and I think that's wrong. The second thing that concerns me about it, aside from the huge advertising campaign, the propaganda, is that it's different from other reporting processes in the sense that the Premier goes or the Health Minister goes to the event and speaks at the beginning and then they go. So there's no opportunity. It's not really a conversation. It's a conversation amongst people that doesn't engage the powerful. And so the Premier, in the end of the day, is going to decide what he decides. And will have had the whole range of views expressed, and he'll get to pick and choose what he wants to do without any engagement. That's all going to happen, not in public, but in private and in secret. So I think that's a concern. And thirdly, I think people, in spite of all that, at these meetings have overwhelmingly supported the public health care system. Yet the Premier, in the meantime, has said that every healthcare project, in future major capital project in healthcare, has to be a P3. He didn't wait to hear what the people had to say about that. He's encouraging the privatization of healthcare. There's an urgent care private emergency room that just opened in Vancouver. We've seen an increase in extra billing in this period. He's not protecting the public healthcare system. And in this city where we live, in this health region where we live, health regions are running in deficit right now and are having to cut services to people to meet their budget demands. And these things are all happening, and they're very significant, and they're changing the future of healthcare before people have had a chance to have their voice heard.
And do you believe that in the end of the day, after the conversation is said and done, will it improve policy or the outcomes that are fostered by the conversation? And if so, why?
Well, I think, first of all, it better. And I say that because for those who've been involved, and you mentioned you were at a session, the stakes are pretty high. I mean, right now we're investing billions of dollars. Every year, healthcare funding has gone up by billions of dollars in this province, and yet, if you stop 10 people on the street randomly, I bet you most of them would say they hadn't seen a significant improvement in healthcare in the last number of years. So there's something wrong there. Whether or not one believes we're going to run out of money for healthcare in 2017 or 2050 or the year 3000 is really immaterial. There's a lot at stake here. We have huge challenges that the rest of the world are facing as well, and if we don't develop our own solutions in British Columbia, then we will have squandered what is and what can be one of the best public health care systems in the world. So for all of us, who value having a public health care system that's accessible to everyone, it better work. There better be some significant change.
On March 24th, 2007, 85 to 95 people attended the Conversation on Health in Burnaby held at the Executive Inn. It was the 8th forum out of 16 forums that were being conducted province-wide by the current government. The conversation in Burnaby occurred from 9:30 to 4:30, and participants discussed a variety of issues, topics, solutions in regards to health care. Today I've brought together 6 citizens who participated in the Burnaby Conversation on Health, including myself. It is the goal today to get engaged in a conversation about the conversation in Burnaby. I will be the facilitator for today, and I welcome everybody.
My name is Bill Zander, and I participated in the conversation on health mainly to make sure that we had at least one voice, and I knew there would be many more that would be speaking in favor of public Medicare, public health, and not go down the road to privatization. So we hope to influence it to some extent.
My name is Jibril Kuruma, and I'm a journalist. I went to the forum because I'm coming up with a magazine for African Canadians, and I want to be aware of the issues in the health sector, and I was there to listen to people and to contribute.
Hi, my name is Bill Steamson, and I'm a semi-retired person, but the main reason I participated in the conversation on health is to ask the question why there needs to be a conversation on health, because as we all know, the Romanow Commission was established just a few years ago by the federal government, went all across the country, spent millions of dollars, collected all kinds of opinions, and I think we're really just treading water here and wasting about $10 to $15 million of our provincial tax dollars budget on a rather useless exercise.
My name is Elsie Dean, and I participated in the Burnaby conversation on health. I have similar feelings as the last speaker, that it was a waste of time. It's a showcase, but still, because it's happening, I felt I had to participate, being a strong proponent of public health care and worried about what the government is, the direction they're going. So creeping privatization.
My name's Sharon Bard, and I participated in the conversation on health, not knowing what it would be like going into it. I did know that I, like others here, have very deeply held beliefs in support of public Medicare here in Canada and the Canada Health Act, and what that means to many of us. It's quite different, but to me it was very important for me to have a voice and to make sure that the voice was heard.
Hello, I'm Evelyn Dick, and I'm from Burnaby, and I attended the conversation on health in Burnaby, and I want to make sure of things that are happening that are going to help seniors. I am very interested in seniors, as I am a senior this year.
My first question is, what were your expectations of the day?
My expectations were that I knew that a lot of people who would be I knew there would be a lot of people who understand the issues and who are experts in their field. And indeed, I met some people who were working in the health field or health sector, and I learned a lot from them.
My expectations were not very high when I went in, because I had read the government instructions and information that they had sent, very biased information, by the way. So when I got there, I was pleasantly surprised to find that I would say at least 90 to 95% of the people were there because they wanted to defend public education. So that was a nice surprise.
I didn't have any expectations. I should admit that I was a little bit cynical going in, right? I was cynical about receiving the package, which I didn't bring with me today, the package that Elsie here refers to as very biased.
Yes, I went in with really no expectations.